welcome to today's COVID-19 media briefing. We have one speaker today, and that's Dr. Angela Dunn, the state epidemiologist with Utah Department of Health. Dr. Dunn?
Okay. Good afternoon. Today I'll give you a situational report. It'll be brief, so we'll have plenty of time for questions. We are up to 6,626 cases of COVID-19 identified in Utah. That is an increase of 188 from yesterday, or a 2.9% growth rate. We've tested over 156,000 Utahns for COVID-19, an increase of 3,301 from yesterday. And again, we're still maintaining the overall percent positive of 4.2. We have an increase of 18 hospitalizations from yesterday, a total of 553, and 99 current hospitalizations due to COVID-19. And we now have a total of 75 deaths in Utah due to COVID-19. That is an increase of 2 from yesterday. Both were Salt Lake County residents and residents of long-term care facilities. Okay, with that, I'll take some questions.
Yes, Dr. Dunn, Ben Winslow with Fox 13. A lot of public health orders are set to expire on Friday. So my question is it your recommendation as epidemiologists that we move to maybe yellow? Do we continue with orange? Where are we at with those, or what's your recommendation?
Yeah, so we're currently reviewing the data for all of the counties on a county by county basis, because we know that this outbreak is in different spots, in different jurisdictions. So it's important for these jurisdictions to be able to make decisions that make sense for them. There are certainly some places in Utah that have seen a decrease in cases while maintaining testing capacity, and they still have hospital surge capacity as well. So those places will likely be able to move a little quicker to yellow. In terms of a blanket statewide order, I think that's a little tougher because we do still have some jurisdictions that are seeing an increase in cases and might not yet be ready to make that complete transition to yellow. We'd want to make sure that we see that plateau and decrease to ensure that our hospitals don't become overwhelmed.
So it's likely we could see a yellow here in, say, southeastern, southwestern, or northern Utah, but maybe central Utah or the Wasatch Front stays orange, that kind of thing?
Yeah, absolutely. I think that's a possibility. Again, given the different jurisdictions experiencing the outbreak in different ways and having peaks at different times, that we can expect maybe the policies might be changing at different times for the jurisdictions.
Hi, Dr. Dunn. This is Carter Williams with KSL.com. The CDC report at least said they plan on sending an alert to doctors over the Kawasaki syndrome-like disease that's starting to be reported in the U.S. Since yellow includes schools reopening, will a CDC alert on anything like that seen in children possibly linked to the coronavirus change guidelines to reopen schools this fall?
Yeah, I think I would definitely have to refer schools reopening to Sid Dixon. I think depending on which jurisdictions go to yellow and when they choose to do that, the decision to reopening schools, might be a separate decision just based on where we are in the outbreak and decisions that have already been made up until now. Regarding Kawasaki syndrome, I mean, that is something that we're certainly looking at to see if we've identified cases here in Utah. There are none that I know of thus far, but it is something scary, and we want to make sure that we get the information out to physicians and parents out there as soon as possible.
Quick follow-up to that. Is it sort of kind of a wait and see before any guidelines are adjusted for any sort of the stuff that's related to children?
Yeah, absolutely. I mean, we're taking it into consideration in terms of that discussion of moving to yellow, of what does that mean for schools if we do it before the official summer begins. That is part of the discussion.
All right, thank you.
Mm-hmm.
Dr. Dunn, this is Michael Orton with the Capitol News Service. As we look at the not only Utah, but the national picture of COVID response, I'm wondering if you could share with us your experience with deadly infectious diseases in West Africa and elsewhere, with regard specifically to motivating the public into compliance. As I kind of make some observations, there are some serious problems with that, and not just the politically motivated protests and things like that. I'm just talking about the normal desire for people to get back to business as usual. And I'm just wondering how your experience informs the effort at compliance with the public.
Sure. I mean, what we're asking Utahns to do is definitely hard. We're asking them to take measures that change our culture in order to prevent disease. We're fortunate in Utah that we haven't seen a surge on our healthcare systems. We've been able to give people the care they need, and everybody's able to access care. So it can be hard for individuals to understand why we're asking them to continue limiting, their exposure to certain people and maintain social distancing practices when we aren't seeing those deaths and the disease at really high levels here in Utah. So I can understand how people are anxious to get back to daily life. So it is about informing kind of how we live our daily lives. I mean, we're not going to go back to quote unquote normal for some time. So we need to evaluate how we can still do the things we love and enjoy, but just in a different way. And that's similar how we approached the Ebola epidemic as well.
How does your training affect your efforts to inform the public on compliance specifically? I mean,
Sure.
This comes from doctors that want specific patients to take their meds or things like that. So I'm just wondering if you have any specific experience to relate.
Yeah, I mean, I think it's first and foremost building trust. So trust between government health officials, the public, and physicians in order to be able to inform everybody with the best evidence and have them be prepared to follow your recommendations. So trust is definitely the foundation of everything we do in public health.
Thank you so much.
Great. Yeah, I'm here. Thanks, Dr. Dunn. This is Roger McDonough with KCPW Public Radio. And you just talked about not going back to normal for some time. I'm wondering if we could talk about the longer term picture. Modeling by some researchers suggests that short of a vaccine, this novel coronavirus could come in waves, a resurgence in cases in the fall, for example. And those models depend on what kinds of measures continue to be taken in a given geographic region. My question is, how is the state of Utah viewing the future of this pandemic? Is there much in the way of predicting that's being done by the COVID-19 task force?
Yeah, absolutely. I mean, we're working with modelers at BYU, the University of Utah, Intermountain, within our own state as well, to try to understand the trends that we've seen thus far to inform, what we think we might see moving forward. I think something important to understand is, we don't know what's going to happen, and no model is going to definitely predict, if we're going to have more surges or if we're going to have, more waves of COVID-19. But we're certainly making sure that we maintain our capacity and our resources to be able to respond if we do have a second wave. So we are being thoughtful in terms of, how much PPE we put out, our funding streams, how long we're going to build up our contact tracing capacity and our testing capacity in preparation for multiple waves, so that we don't kind of, use everything up right now in the next couple months, that we can have this sustained strategy over the next 6 months to a year.
Can I ask just one follow-up, which is the sort of end game from the state's perspective just the development of a vaccine? Is that what stops the pandemic cold in its tracks at this point, or is there another option for halting the spread of coronavirus?
Yeah, I mean, so there are a couple options, right? They all are around building herd immunity. We're not going to be able to prevent disease effectively until 60 to 80% of the population is immune to COVID-19. And that happens one of two ways. Either people get infected or they get a vaccine. And we have such low prevalence here in Utah with COVID-19. I mean, my guess is we're less than 5%. We're doing studies now to more accurately predict that. But we are far away from having herd immunity due to everybody being infected. So we are looking toward that vaccine to be able to provide stability in our ability to respond to COVID-19.
Thank you.
Hi. So there's a new report released that shows that Utah is the state with the least vulnerable population. I know that you just said that we're far away from herd immunity, but knowing that, does that maybe push us more towards wanting to do herd immunity, knowing that we have less of a vulnerable population? And since there is no vaccine and herd immunity could kill the vulnerable population, when can the vulnerable population start to see some sort of normalcy return to their life? Sorry, that's a couple of questions.
No, that's okay. I mean, I think I haven't seen that report specifically, but it's not surprising that we have a low vulnerable population right here in Utah. First, we know that COVID-19 impacts those over the age of 65 at greater rates than the younger population, and we have the youngest population in the whole U.S., so that alone puts us at lower risk. We've also done a fantastic job with our long-term care facilities in terms of being prepared and preventing outbreaks, even though we unfortunately we have had some breakthrough in those efforts in terms of outbreaks happening in some long-term care facilities. Compared to kind of our other states, we have done an excellent job in terms of stopping the spread within those facilities. So we have a lot of things going for us. Our testing capacity and our ability to contact trace every positive certainly help as well. So again, it's not surprising that we have a low vulnerable rate here in Utah. However, from a public health perspective, we never want to put lives at risk for the unnecessarily, for the sake of kind of multiple people, being able to quote unquote get back to normal. So everything we're doing right now is to balance that ability for individuals to go to work safely, be able to go to school safely, while also protecting those who are at high risk for severe disease. And those who are at high risk for severe disease are going to have to be really vigilant until we get that vaccine. So, when we talk about going back to normal, that's pre-COVID life, might never go back to that.
Thank you, Dr. Dunn. About that, you mentioned earlier about some areas possibly moving into yellow and others not doing so. With the increase in cases in Washington County, which is the area that had asked for yellow for the last week and a half, but with the increase in cases, is there less of a possibility now of Washington County, starting Utah, being included? And as a follow-up, mentioning Washington County, that's where a majority of the cases by far have been, while Iron County and other areas of southern Utah have had no cases. Is there a possibility of just Dunn County moving or staying in orange?
Yeah, so every county has the ability to make their request to go to yellow, and that goes through General Burton at the Department of Health, who then makes that recommendation to Governor Herbert. So from my perspective, I provide, that best public health expertise. And of course, the decision to ultimately switch to yellow is a combination of a lot of opinions and experts coming to the table to make that. So for any county, what we look for, of course, is low hospitalization and ICU utilization. We're also looking at case trends to make sure that they're decreasing while maintaining testing capacity. So that's what we're looking for specifically from a public health perspective. It becomes tougher in kind of the more rural counties to have those exact metrics because the population is so small and they just don't have a lot of cases. So being able to accurately identify a trend just isn't possible. So those counties just need to be extra careful and kind of look at those surrounding counties or look at them all together to be able to understand where their trend might be going. And so that's what we're doing at the public health level.
Okay, thank you.
Hi, yes, thank you, Dr. Dunn. This is Brittany Johnson with ABC4. 2 questions for you today. Funeral directors in other states have expressed shortages with PPE equipment. Are we having those same problems here in Utah? And the second question, do we have an update on the jails and prisons? Do we have updated numbers as to how the virus is spreading behind bars? Has the curve been flattened inside the jails and prisons? And what's the risk of infection spreading outside of their walls?
Sure. So we have been working with funeral directors from the beginning of this outbreak to ensure they have the necessary PPE. And I'm unaware of any shortages right now for that specific population. We're working with them in addition to all businesses to figure out their needs and make sure that they get met. In terms of jails and prisons, we don't have any current outbreaks going on. The jails and prisons have been doing an excellent job in terms of quarantining all intakes for 14 days. They also screen and test and do the same protocols for their staff as well. So we haven't had any recent outbreaks. And in terms of spreading outside of the walls, what we look for there is, of course, the staff. And that's why they have to be screened every single day and then tested immediately upon showing any symptoms. So those efforts are in place, and they seem to be working.
Hi, Dr. Dunn. Again, Nicole Newman from ABC4. My question is, now that we're transitioning into reopening, if there was a spike in positive cases, say in one specific area, does the state have the ability to test everyone in that entire county where they're located, or potentially the entire state?
Sure. So, when we talk about targeted testing, it's really important that we focus on hotspots. In general, we can narrow those hotspots down to a very small area. The hotspots are typically not encompassing an entire county, but usually a community. And that's just based on the biology and spread of the virus. It's person to person, so it's communities who are at risk, not necessarily entire counties. And we're doing that now. We're going into hotspot areas and offering tests to whomever wants it if they happen to live within one of those hotspot areas. So that's ongoing, and we will certainly continue to push that and expect it to become even more frequent as the economy opens up more. Okay, thank you so much. You guys have a wonderful afternoon.